Good evening, America. Coming to you live, Contra-Dictions, episode 13. We got myself, Freddie, I got Glenn with us, and we got a new member, Lark Wood, who's going to kind of take the reins a little bit here and show us how to do things around here. We got a little bit of COVID talk.
Little bit.
Let us go with Lark right here real quick. Let him introduce himself, give him a little background. Let him introduce himself to America. What do you say, Lark? How you doing, boss?
I'm awesome, Freddie. Thanks for the intro. My name is Lark Wood. I'm longtime friends with Kenny, and watched the show. Tried to help lead some directions with production and using StreamYard, the software that we're on tonight. And I figured tonight with Kenny out, and Glenn and I talked to Fred. We didn't even know if you were going to be available. I know you got kids, you got things going on. So Glenn didn't know how to run the software, and I was like, no problem. I'll take the reins. And with Kenny being out, let's just say sick for now, I figured, there needs to be an episode on COVID, all things COVID, with everything going on that's COVID crazy right now. And it's literally everyone's favorite topic to not talk about, yet everyone's favorite topic to talk about. Everyone will tell you, I'm so sick of talking about COVID. And then in the next breath, give you some article or some statistic that they read 15 minutes ago about COVID. So I was like, all right, well, let's talk about it. And hopefully Kenny might pop in with us for a few minutes later on. We might even have a doctor popping in with us a little later on also to talk, all things COVID. So, I mean, let's get started. Freddie, what's up in your COVID world? You got any personal experience, friends with it, family? What's the deal?
Baseball just started up, youth baseball that I coach just started up. And we're dealing with how to deal with COVID with 12-year-olds. How to stay socially distanced, how to still do practices, and how to maintain our separation, but still get a practice in. So while it's challenging, to say the least, we still got the practice in. The kids still had fun, but you worry a little bit because you got to depend on other folks, to be honest, and to like, hey, my kid or my family member was sick, so we're not going to come to practice. Well, if you don't come because of that, you're 14 days bare minimum not coming back to practice. So is it a good thing that we're telling people to stay away for 14 days? Or do you think that's going to make them hide the fact that they're sick so they can play? Knowing me as an 80s kid, if I was sick, I don't know if I would be telling the truth. I might be like, hey, look, I want to play. You know what I mean? That's just my mentality. That's how we were raised, but we didn't have to deal with this kind of epidemic.
Freddie, we're also a generation. We're also a generation of kids who hid concussions so that we wouldn't come out of games, and we were like, "Nah, I'm just cool." We invented
absolutely.
We invented the term. I just got my bell rung. Like that. That's not a concussion. I just can't see straight. I'll be fine.
I only hear whistles in my ear, but I'm good, coach. Send me back in.
Right. We grew up. You can't just rub some dirt on COVID, unfortunately. That's the generation we grew up in. Glenn, what's up with you in your COVID world?
Oh, man. Well, there's been quite a bit, actually. My best friend recently had COVID. He's got a big family, and he pulled through it pretty good. I mean, in general, he was a healthy guy, but, he did say that it was like a punch to the rib shot every time he would take a breath in. So it does. We all know it affects your respiratory system. Also, for me personally, I have 4 kids, one of which is a 9-month-old and also a pregnant wife. And so my oldest son, my son is 14 years old. And then I have 2 daughters, one 10, one 7. And we're trying to figure out, exactly what's going to happen. I mean, I just have, several questions. I mean, what happens to a teacher if a student, in the class gets ill, does that mean that the entire class has to quarantine for 7 days or quarantine for 14 days? There's just a lot of questions and a lot of things that I'm sure a lot of parents, a lot of families, are interested in knowing. So yeah, there's definitely a lot to talk about, a lot to sink our teeth into, as I always say. So I'm ready to sort of dig in, man. Let's go.
For me, COVID has affected my family on my wife's side.
Okay.
She has had let's see, 2 aunts, 1 uncle, 3 cousins, and then like a kind of a one-off family member pass away from it. Now, the one-off family member was well past life expectancy. They were in their high 80s. I'm not saying anyone deserves to die. I'm not saying any life doesn't matter. You kind of follow what I'm getting at here, but
right.
They were in that range where, like, if they'd have caught a bad flu, same deal. I'm also not saying it's the flu. Don't put words in my mouth. Thank you. But it's affected my family in a weird way because my wife's cousins, they're like in that 25 and under range, asymptomatic. They no symptoms. And they keep testing positive. Like every time they go back to the doctor to test to see if it's out of their system so they can go back to living their life, nothing.
Wow.
They keep showing up positive. Her one aunt tested negative over and over and over and over again. But she had it. And then what happened was she got the antibody test, and the antibody test said, "Oh yeah, you had COVID." But the test that she kept taking said negative, right? And so you wonder why we struggle to trust and believe the test and the results and everything else that we're getting. And it's because the reliability sucks of the tests and the exams. And then the one uncle, he's in around that 65 range. He was sick for 21 days with a fever. And so he was on his butt with COVID, but every single outside of the 85 plus, the rest of them are all fine. Now at this juncture, like they're healthy people now. And so it's a real mysterious disease, or virus. And we don't know what's going to happen next with it. And I think it's funny when everyone says, "Oh, we're about to have a second wave, or we're going to have this, or we're going to have that." This has been in existence for 1, 2, 3, maybe 4 months now. That's as long as this has been around. And yet we know what's going on. Everyone knows beyond a shadow of a doubt what the best thing to do is after 4 months. These are people that can't do 4-month-long relationships trying to tell us what's going on.
Right.
Yeah, it's crazy, man. And it's actually, so Mike Pence just came out 2 days ago, and he said that over half of the new cases over the past 2 weeks have been individuals under the age of 35, which I find to be, pretty fascinating. In the beginning, it was just old people and people with pre-existing conditions that we had to worry about. And now it's pretty much everybody. I mean, you can't run, you can't hide from this thing is basically what we're starting to learn. And yeah, Lark, like you said, I mean, over the past, I would say 4 months and really quick, I think I had it. I think I had it. I got really sick right before Christmas back in December. I had never felt anything like this ever in my life. And I'm just stubborn. I'm not the type to go to the hospital, but I was sick. Like I was really jacked up. Yeah.
Glenn, none of our viewers would have ever suspected you were stubborn. That's no. That is shocking information. Breaking news.
Yeah.
Glenn's stubborn.
I'm guilty as well. I don't know. Maybe it was the flu in November, but again, we don't know for sure because apparently it was around back in November and nobody knew.
I don't believe that for a second, man. I had the dry cough. I couldn't breathe. My body aches were crazy. And I was sick for a while. Like usually when I get sick, it's over within 3-4 days. I was sick for like 10, 12 days.
All right, we got a comment from Dave, and I threw this one up on the screen. Someone I know, their mother-in-law was tested twice when she went in hospital for heart condition, both times negative. She ended up passing, and guess what was on her death certificate? COVID-19.
You gotta be kidding me.
That's one of the crazy conspiracies about this is that the hospitals get paid per death. And so when they can, they're coding things to COVID. Now, look, I'm not saying Dave's not telling the truth. But I have no idea. Like, that's one of the conspiracy theories that I'd love to get to the bottom of and find out like how true that is, because, not that all conspiracies have some truth, but I kind of feel like that one's got legs. And then Dave followed it up with this comment: heard hospitals are getting $30,000 per COVID death. Not sure of the truth, but that makes sense. And again,
I mean, if you're getting $30K per death, you're probably going to sway a little bit to bring in a little dollar here and there. You know what I mean? Like,
well, and the hospitals got to get their money. I mean, the hospitals are the ones out there doing what they're doing. They got to get, they're not cheap to run. And with all the revenue they lost with all the elective surgeries being gone, it doesn't shock me that they would do everything I've heard of guys that were shot and killed that were, but because they tested positive, they coded them to COVID. Now, I'm pretty sure that bullet didn't give you COVID. I'm pretty sure it killed you. But that's what their death certificate saying.
And I don't know if I'm not 100% on this, but I did read an article that was speculating that the death of George Floyd, I mean, we all saw it on tape, but he also apparently tested positive for COVID-19, and they put on his death certificate COVID-19. So that not only is that kind of messed up and a little insensitive, but now it makes sense. I understand why they would do that. But it does kind of seem odd to me, like, there's a lot of ways for hospitals to make money. Why would they be making money on the death of COVID-19? I mean, they could figure out some sort of way to make money on the treatment of it, it seems like, right? Or am I off there?
No, I think you're probably spot on, but the problem is that the numbers that escalate probably didn't meet the media narrative, right, so to speak. So everybody wants to be scared of something. And this goes back to the conspiracy of Kenny, what he was saying. It could have been a conspiracy ran by the Democrats trying to get everybody back in the house and, get online voting or mail-in voting. You know what I mean? But just to keep people frightened. You know what I mean? Like keep them out of the streets, keep them in their house.
I'm not laughing at Kenny, but I'm laughing, and it was because of something Kenny said. I want to throw
me too, Lark. Me too, buddy.
No, that's a whole different movement, Glenn. That's a whole different movement that we're not discussing. I'm going to share my screen real quick because I pulled up some stats that I thought were pretty interesting. And this chart, and this is on a website called medium.com, but the information is done by a person who used to be a professional statistician. The risk of dying each year, okay, is the blue line is the normal death rate for men. Yes, normal male death rate. And then the coronavirus death rate, like we jump up at our age, we're less likely to die of COVID than we are of like driving to work. You see that? You see where that chart is? Because I literally just turned 40. So you could see right here, I am less likely to die of coronavirus as I am drunk driver, texting and driving, choking on an apple. Okay. Sure. And the dots like are right there, right along with the line. So like we do have a little bit of this like fear of dying from this disease, right? Or this virus. Like that's kind of the big thing is like who's signing up to die today? Like no one is signing up to die today. But that's kind of where it has people trying to be scared of death. And I'm going to take this down off the screen, but then I'm going to bring it back up when I find the other stat I want to find. But literally, it was like you can choose to look at this one of two different ways. You can look at it as the percent increase you have of dying every single day, or you can look at it as your total percent dying every day. And I think I read like for us, we're all close to the same age-ish. Our chances of dying because of COVID-19 go up 30%.
Wow.
Yet we are still a fraction of a percentage of dying every day. So yeah, it went up 30%. Do you want to look at it that way? Or do you want to look at it as you are still less your chances of dying in any given day are still at like 0.05?
Lark, in between us starting, he asked me a real question, and I've never been posed this question before, and it hit kind of hard because I didn't think of it in terms of this. Like Glenn, if someone told you if you go outside your house, you have a 1 in 200 chance of dying, would you go outside?
Yeah, we talked about this a little bit earlier, and death is nothing to play with. So I probably would not go outside. Like if you have a
19-year-old Fred, 19-year-old Fred, screw it, I'm going out. But 44-year-old Fred, no.
Right? Like, hey,
too much on the plate these days, brother.
It's senior week. I want to hit this. I want to hit this chart really quick. This is the chart I was talking about. So you could see where it says average year probability of death. So 40 to 49, we are at 0.2% chance of dying any day. Okay, 0.2. Then we have combined death rate with COVID is 0.3. So we have a 13% increase in our chances of dying now because of COVID-19. Does that scare the crap out of you? Or does that say, I'm still below 0.5 of a percentage. I'm going to die 3 days out of 1,000. Not 2 days, not 1 out of every 200 days. All right, I'm going to pull this off the screen because we got a guest that just popped in with us. Hold on. Let me stop screen share. And ladies and gentlemen, starting at punter for the Kenny, what's going on, boss?
There he is.
Uh-oh.
Hold on. Is this virtual?
Yeah.
That's messed up, Fred. You don't got to do that. So welcome back, Kenny, man. I miss busting your balls, brother. I miss having my balls busted, right?
Hey, I miss you guys. I look forward to being back soon. I actually surprised everybody. Actually, I was going to be in the hospital if we'd done this last night. I got releases this evening. So I've been here for a couple hours now and just tried to rest up. And feeling much better, though.
You sound it. You
Sounds
sound
like
much better.
Yes, you sound great.
All right, Kenny, why don't you go ahead, and we didn't really announce this, but why don't you go ahead and talk for a second and talk about what's going on with you?
So about a week ago, Wednesday, in the middle of the day, I started getting a really, really bad headache. Actually, midway through the day, I had to go lay down, and I believe that night I called Glennon and Fred and told them that I didn't know if I was going to do this show. My head was throbbing really bad, and it just kept getting worse and worse. And then actually, I had my kids coming in town, which was terrible. I actually had to pick them up from the airport the following day. I couldn't even drive back. My daughter had to drive back. After about a week of that, and me being in my room trying to stay separated from the kids, letting the kids, my daughters from, and I don't want to get too much personal stuff, but letting my kids spend some time together. Then I went to the hospital, the VA. We can get into that at some point, why you just do not want nationalized health care with no privatized. I just will not work. But so I went to the VA. They gave me a test, told me they'd let me know in 3 days. I couldn't make it the third day. After the second day, I had to go to the hospital. So at that point, I was in it about a week. Got put in there on the following Thursday, and then got out today. So I was in the hospital Thursday, Friday, Saturday, Sunday, Monday, and got out this evening. So that's the recap. But in that point, I really was having trouble breathing. I had pneumonia. So thinned out a little bit, lost about 8 pounds. And that's where I'm at.
So
go ahead.
Okay, I was just gonna say, so I know you've been out for a little over a week now, and I mean I'm glad to see you back here, and you're feeling a little bit better. So you had the COVID as well as the pneumonia, correct?
That's correct. Actually, the VA it was kind of stupid. So they called me while I was actually in the hospital. When I had just gotten to the hospital, checking myself in because I couldn't breathe. And I thought that was probably my results. And so I tried to call them right back because I was sitting on it when I was talking to the doctor. I was right in the middle, so I wasn't going to answer the phone ringing. Well, once the doctor got done talking, I looked at it. It was a VA hospital. So I called the VA hospital back. They tell me, oh, we have to have your actual primary care physician be the one that tells you over the phone. I'm okay, we'll get them on the phone. Oh, well, we can't get a hold of her right now. We'll have her give you a call back. I'm like, you gotta be kidding me, right? So I'm sitting there. I'm on the doctor's chair or whatever. And the doctor's like, well, just let me know so we can know, because they need to take you to a certain location if you have corona. So he leaves the room, comes back in. I call. I'm just sitting there waiting. This is at 10 o'clock in the morning. I wait for an hour. Call back at 11. Hey, what's going on? I need to know. I even got the message on my answer machine because I hadn't checked my first message. And it says, well, you got your results. but we have to tell you person to person. I said, okay. So they say, oh, well, we'll leave another message for your primary care person. First of all, I don't even know who my primary care person is. I don't go to the doctors much. I'm a very healthy person.
Me neither.
Yeah, so I don't even know who that person would be. They could have told me guy, girl. Like they asked me that. Is it a guy or a girl? I don't know. Look, Google it. I don't know.
Depends on who's working at urgent care when I get there.
Exactly. So then that's at 11. They tell me, no, we still can't get a hold of the person. Then I wait till 4 o'clock. This is 2 o'clock. 2 o'clock.
Wow.
I've been on the chair now for 4 hours.
Wow.
I call up, I'm livid. I'm like, hey, somebody's got to tell me, like, this doctor already came in. They just gave me another COVID swab, told me it was going to be an hour. I'm like, it might as well y'all just tell me. I've already got another test that's coming, but I mean, this doesn't make, I'm just kind of venting at this point. So the person goes, oh, hold on. She's in the office. Let me get it. So then she calls, gets her on the phone, goes, okay, this is whoever the hell my primary care person is or whatever. Yes, you have COVID. And, so that's what you got. Okay. I'm not even kidding you guys. I hang up the phone. 10 seconds later, the phone rings. Hey, this is, I don't even remember what the hell her name is. Your primary care physician said, she goes, so you have COVID. I said, didn't I just talk to you like 10 seconds ago? No. So they just answered the question that I've been asking for 4 hours, lied, said it was you, when they could have done that 4 hours ago.
Yeah.
You had to stick 2 swabs deep in my nose again.
Well, hold on. For anyone who's just joining us, welcome to Contra-Dictions. We're 20 minutes in. My name is Larkwood. I'm supposedly filling in for Kenny, who is, here. And Kenny is talking about the fact that he just tested positive recently for coronavirus. He's dealing with coronavirus and pneumonia, and he's fighting through it and just doing his best to get through it. And he's talking to us right now about his experience at going through it, the testing process, dealing with the VA, and just it took 4 hours for him to find out and get his positive test results, which is that's absurd. No, I'm sorry, not to get his results, to get other people had his results and just didn't tell him. Can you imagine for 1 second thinking that you have it, feeling the way I'm sure he felt, and sitting on a hospital bed for 4 hours, feeling this way, and then add on to it the anxiety of what's wrong with me? Will someone please just tell me?
And knowing they have the results, but they're not telling you until they can get a hold of your primary care physician.
Well, and they have to do that. My wife is in she works in the medical field, and unfortunately, there's all sorts of potential HIPAA violations and things like that. So it does suck. It really does. But yeah, I don't understand it though. What were you gonna say?
They can be right, and it can still be broken, Glenn. They may be doing it by the letter of the law, but it's broken.
And I thought about that.
I agree.
I'm on the insurance side of that stuff. So, but the problem is, at the end of the day, they did do it because they did. Then that call back let me know that they gave it to me. And you got to go through I got to give them all my information beforehand, anyways. So each time I call in, I got to give them my full social, give them my phone number, my email address, my branch of service, my EAS, all these other things. And, and to be honest with you, here's something else. This just goes out to all the people out there. It's not that we don't appreciate, the, hey, how are you doing? But it does seem like certain people just wanted to know whether you have COVID so they could tell people they know somebody that has COVID. I felt like people were really interested in whether I had COVID, yes or no. And it was like, I felt really, really sick. So if I didn't have COVID, then what? Then I'm not as sick. Or if I did have COVID, well, first of all, there's no cure for COVID. So then So then what did you want to know for, And I'm not trying to be a Debbie Downer, but it did get a little bit annoying. And so I just wanted the answer so I could just put it out there and be like, okay, that's that. But for the hospital, they needed to know because they just keep you in this one area, and they need to know where to put me in what wing, basically. I will tell you guys a couple things I found out while I was there. In this area, there was a boost because a elders home thing had it run through it. So there was 4 different deaths the days that I was there. All people over 90. There was another 30-year-old in the room next to me. He was pretty okay as well, with no major underlying conditions. I will tell you guys, I do have an underlying condition. They did some stuff on my heart. I didn't. It's not a major thing, so I'm not trying to blow anything up here. But my heart's the one side is better than the other, and it's something that I had a feeling was going on for a while, but it's nothing to cry home about. I'm not dying or anything like that, but it's just the one heart's maybe 65. The left side's like 65%, where the right side's 100%. So, that leads to things like asthma, bronchitis issues. It's kind of the part that connects to your lungs. So there was just a little bit of concern there, but that's about that.
Wow.
So are you not contagious any longer, Kenny? Are you good? That's why they sent you home. You're not contagious?
No, it's so weird how they talk about it. Even the doctors, they said, oh, well, when you get home, self-quarantine for 14 days, which is funny to me because they said that same thing when I got there if they didn't admit me to self-quarantine for 14 days. So I don't know where that data, where it stops at or starts at, but they won't test my kids, even though they know I had it.
What?
They were all here.
Are you serious?
So here's the thing that Lark was saying earlier.
With any of my kids because they don't have symptoms.
Like we were saying earlier before you joined, Kenny, like this is the reason nobody knows anything. Like, because this kind of what you went through is exactly what I'm sure most Americans are going through when they get tested. They're not testing their family members. So eventually, who knows if that stuff's going out there and infecting everybody else.
And if somebody in your family does get it, who knows if they got it from you or if they got it from somebody else or, whatever the case may be. I just think that that's very odd. Really quick while we have you, because I know you're not feeling too well and I know you can't. I know you can't stick around. I do want to ask you, can you just
stop coughing while he asks a question? Damn.
Mute me.
Can you just no?
It's a mute button. You've done this before.
I know. I couldn't find.
No, he's too busy coughing, right? No, but really quick, can you just sort of talk about some of the specifics as to how you feel? I know we all obviously know that it attacks the respiratory system. And just for those that don't know, getting COVID with pneumonia, based on the research that I've done, is fairly common. A lot of people that get COVID-19 usually get pneumonia with it. So, I mean, is there a difference? Have you had pneumonia before by itself? Can you sense or can you feel the difference between the COVID and the pneumonia, or your breathing, how it feels? Talk about that a little bit.
Sure. So it's funny. The first thing I did was contact a buddy of mine I know who had a bad version of corona, because I will tell you, I've met 3 different people who were working in the hospital, and so it is different between people. Some will just have a light cough. One of the big difference between the COVID symptoms and pneumonia is that with pneumonia, when you cough, you get phlegm. Okay, so you're going to cough up the stuff in your lungs. You're going to have liquid in there. That's how they noticed that I had pneumonia. Damn, sorry.
I'm giving you a pass right now, but you never should have told us that you're not dying, because now we're not going to lay off. Like,
there's no now,
you don't get the sympathy once you're like, yeah, I'm really kind of fine, but I've got COVID and I cough. Like, now we have to razz you because, like, clearly you have you have a conspiracy virus right now. Like that's what you have. This is may as well be a computer virus.
So when you have just the COVID, okay, you actually don't cough up anything. So it's one of the things about COVID is your body feels like you have pneumonia or bronchitis, and so you're coughing, but nothing's coming up. There's no phlegm, there's no nothing. You're just coughing, and it becomes very hard to breathe. You can't really inhale or exhale very easily. And so, that's where I was at. And then I just tried to probably tough it out too long at home, because I didn't want my kids to see me going to the hospital. So I was trying to make it until my daughters went home, and I came up one day short. I just couldn't breathe. So, but I was trying to, you're the dad patriarch of the home, and I had all 6 of my kids here. So I just wanted to put on a strong.
Yeah, so were they around you?
Yeah, man.
What'd you say, Fred?
Were they around you? I mean, that's.
They were staying at my house.
Why wouldn't they want to test your kids? It's crazy to me.
Yeah. I asked both my exes about it, and they said that they had to have, they tried to get tested, and they told them they had to have symptoms.
What state do your kids live in, Kenny?
What'd you say?
What state?
What state do your kids live in?
Oh, well, 4 of them live here in Georgia in the same city.
And they won't test them in Georgia either?
No.
Damn.
And in Maryland, they won't test them. So I have to kind of circle back around because I was kind of delirious at the point. So I want to make sure I did talk to both of them. I believe that I did. Both the families. I will say this, both my exes were very good. And one of my exes actually drove my daughters to the airport, which I wasn't really expecting, which was nice. So, it shouldn't take people to be on their deathbed for people's exes to be decent, but better late than never. So.
Yeah, right. Don't complain when you did it. Don't complain.
No, I'm not complaining. I'm very grateful for it. I'm grateful for, those, most know I have business partners at DMV Insurance Agency. Very grateful for them. Fred, to you and Glenn, Lark checking on me. I did feel very humbled by the amount of outpouring of respect and concern. And I don't want anything I said earlier to seem like it didn't want that. Just, there's a lot of thoughts that go on in your head, and you're kind of locked down because, but the alone stuff is not that bad of a deal. A lot of people think, oh, well, you're alone. It's like, yeah, but you're in a lot of pain. You just kind of want to rest anyways. So,
yeah.
But I'll watch the rest of the show offline. I look forward to being back. I should be able to be on the next show. Appreciate you, Lark, helping us out. And Fred, I know you were sick as well. Hope you're feeling better, buddy. And
totally. Don't eat it.
Really quick, Kenny, before you leave, I know you're getting ready to get out of here, and we appreciate you hopping on. I just did want to say that there has been some recent spikes. I'm sure you've probably been watching the news. Florida's had some spikes. Texas had some spikes. They're halting their reopening and things like that. I gotta ask you the $1 million question while I got you on here. So now that you've had COVID-19, are you still on the side of Trump and thinking that it's a Democratic hoax? I had to ask.
Yeah, I definitely think it is. I mean, when it comes down to
double down, Kenny.
Here's the thing.
Not real.
No. It's never. It's not that it's not real. It's whether shutting down the economies is the right thing to do.
Okay.
I am a decent person in decent health. I'm on the underside, but I'm basically 40 years old, 39 years old. And, does it suck? Yes. Is this worse than the worst strep throat that I've had in my life? It's probably close. So,
Andy, did you ever have the neurovirus?
Do what?
Did you ever catch the neurovirus when the neurovirus was the thing that was going around? Like you just were like couldn't stop throwing up that one. The people were dying of dehydration. Okay.
I have. I mean, in all fairness, I've probably been sick 2 times in the last 10 years. And the last time it was pneumonia / bronchitis. And that was when right before Jordan was born, and Jordan's 16 years old. So it's been even longer than that. I mean, I just don't get sick. It's not something to fool around with. I mean, now there's a lot of people, again, the 3 people I talked to who are nurses or doctors at the hospital that actually had it before. They didn't have as severe cases I had. But this should not be shutting down an entire global economy. So it's not that it's not real. It's real. I mean, the idea, first of all, and I said this a long time ago, is that it was funny because at the time I had said in my video, I said, is this a pandemic? No, but could it be? Yes. And if it gets in enough, it's going to get to everybody. I wanted to do where we quarantine the sickest and kind of let it slowly matriculate through people, because just like my situation, I've been here now for 10, I've been about 13 days, I guess, something like that. And so it's going to be a process for people, but I'm not dead. And there's a lot of people that, need to work, and, that kind of stuff's important too. So I don't think it's all just a big scam. I also just don't think we should be shutting down economies. So there's a fine line, and you got to make sure you pick the right one. But I think it's a joke when it comes from liberals, just like, somehow all these people, when it was rioting, it's okay. But now all of a sudden the riots are done and they're like, oh, let's shut down restaurants that have 50% capacity. I mean, they ask me every time, how did you get it? How did you get it? And the truth of the matter is, I don't know exactly how I got it. Okay. I'm in a very small area with barely any people. I think it was a doctor that I was talking to while I was throwing darts. I think that they probably brought it from the hospital, and I don't know, maybe 6 feet or whatever. I mean, all I did was say, hey, what's up? Gave the person a hug, and that was it. So,
and I'm assuming you were wearing your mask.
Yeah, right.
Yeah.
Negative.
Kenny, here's the deal. We want you to take some time and get better, so I'm going to let you go.
Yeah, buddy.
As the guest
Thanks,
host,
guys.
I felt it was my opportunity to bring another guest in with me. So I've brought a guest. His name is Dr. Chris Turnpaw. He is going to join us. Chris is one of my wife's doctors and my doctor. Chris and his practice are the people that are responsible for helping me lose 40 pounds in 6 months just by doing blood tests and giving me dietary advice on my blood tests, etc. I trust Chris literally with my life in saving it. One of the reasons I don't currently have a comorbidity is being obese. And I was pre-diabetic. So that would have been 2.
Wow.
Is because of Chris and the help that Chris gave me. So Chris, welcome to Contra-Dictions. I am only a guest today. Kenny, who is above me and to my screen right, he just recently caught COVID-19. And so I'm kind of filling in for him tonight because we weren't sure he was going to be able to do the show.
Okay.
One of the crazy things that we just found out is that he tested positive. He had weekend custody of his kids. Same time he finds out he's tested positive. His kids have now gone back to their moms, and they won't test his kids, even though they were with him while he had it, while staying in his house. What is going on with the testing that you can speak on that you know of?
Well, it's interesting because there's some stipulations for testing, and some of that is you have to be in a high risk category. You have to have an active fever. You actually have to be somebody that they think has a high probability of coming back positive. I think the mistake in that is that we're looking at his kids, which I'm assuming are younger, right? They're still
16, I think, is his oldest.
So they have a very, 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 very low mortality rate. So the death rate from COVID for them is almost negligible. So they're not going to get tested. The problem is they're going to be the silent transmitter. They're going to be the one that gives
Right.
it to grandma, grandpa, somebody else. And then we're going to scratch our heads and say, how did this happen? Well, how did this happen? And, you know, there's no shortage of tests. We test here in the office. There's a priority of tests, though. There's prioritizing testing for those who are at most high risk or at greatest need to be tested positive. So if we're not willing to ask the tough questions and take the tough steps, we're not going to conquer this. So if we're not going to test his kids, and then we're not going to track where they're not even track. I'm not like saying they need to have the digital tracker everywhere they go, but they're potentially burdening everybody they come in contact with. And, you know, that's where they're going to be around grandparents or elderly aunts, uncles, somebody like that, or in a grocery store or something like that around elderly people. And that's not risk prevention. That's not even taking the steps necessary to kind of curb this thing or understand where it's coming from.
Really quick, I just want to ask you a quick question here. So do you believe that they're, you know, being reluctant to test people due to the fact that testing is low? The accessibility to testing is low, or I was under the impression that it had ramped up over recent weeks.
So let me just understand the question. Do I believe that they're not testing because the testing capability is low?
Correct.
I think that if you're going to take steps towards testing all these people that are low probability, low risk, they're prioritizing to the high risk people. I do think there's plenty of testing available. I mean, there's hundreds of thousands of tests that can be done all the time. But if you're talking about resources of manpower or woman power, you're talking about people power that can actually get out there and test with their protective gear on, because you're testing high risk people all the time. So you're basically wearing the full blown body armor just to test somebody. You're limiting yourself by that. But if I were to test those children, I would walk out, I would have gloves, a paper gown, face mask, and I would walk out and test them. It would take me, combined, both those children would take me maybe 30 seconds to test them. The same way you test strep throat. You don't have to do the deep nasal swab. You can go deep down the throat like you're testing for strep throat. Pop it in the tube, seal it off, send it to LabCorp. I'll have the answers back in 24 hours.
Yeah, Kenny would have liked you to do his test. I'm pretty sure he explained that he did the way up the nose, tickle the brain test.
Yeah, you go up the nose and it comes down, and it has to come down the back of your throat, but up through your nose. Yeah, that doesn't sound fun.
Oh.
No, that sounds not like what I want. Chris, I shared this earlier, and I kind of want your feelings on it. This is a chart that I found online, and I know I normally just text you these, and I probably could have given you some advanced warning on this, but this is a question that, or a chart that talks about like your average probability of death just randomly on any given day. Right. And then it combines it with the death rate of COVID. Now you look on the right, you can see the reason people freak out, because my chance of dying has gone up this year 13.57%. However, it's now only at a whopping 0.3%, right? So, right. But as you start to look down this chart, is this what you're seeing in the medical community as an accurate representation of what's actually going on with COVID?
Yeah, I would say that's fairly accurate, but then it's how it's slanted, right? So you're saying my whopping 0.3% from 0.2%. So the question still begs, and it's an accurate statement what you're saying, but I don't want to reach the way we describe is you reach your hand into 1,000 balls, 9, all of them but one are black and one's white. Are you willing to reach and pull out the white ball? The white ball means you die, right? So right. Do you want to increase that by one ball per 1,000, 10,000? So the numbers are very low, but the reality is any increase, that's why you wear your seatbelt when you get in the car. So it's the tale of two cities. I don't know if I'm answering your question, but these numbers are incredibly low. And there is increased statistics for the flu, for everything you do. There's death rates for every illness that you have. And they are incredibly low. And if they're skewed towards percent increase in mortality, it looks high because it's maybe a 13% increase, but it's going from 1 in 10,000 to 2 in 10,000.
Chris, another thing that I read by this same author, and they were a statistician over in Europe, And one of the things they talked about was herd immunity, and how we, in any pandemic, the closest we've ever gotten to herd immunity was in and around 30% before the virus itself mutated into something that was no longer the death trap that the original virus was, right? Like SARS. And I think there were a couple others. You would know them. I wouldn't, because you did more school than I did. But the bottom line, my bottom line question here is that still accurate? Is herd immunity still like a great pipe dream that we're probably not going to get to before the virus mutates? Or are we still like waiting on a vaccine?
Well, a couple pieces to that. I think the virus already has mutated. I think it's already gotten weaker. I think the virus has mutated to a weaker strain as we speak. I think that's kind of being played out. As more people are probably going to get it, the transmissibility of this thing's pretty high. Less people are dying. We're getting more positive tests, but less people going to the hospital. So I think it already has mutated to a weaker strain. And with this one particularly, when you get herd immunity, it's kind of like if everybody gets chickenpox, then nobody else can get chickenpox because it has nowhere to go. And the people who got chickenpox can't get it again. Well, guess what? You can get this one again, probably. So this one, if you get it, there's an 80% probability, as far as we understand, you can get it a second time, just like you can get a cold, and 8 weeks later, you can get a cold again. So the herd immunity means you got it, you became immune. It can't be, then you're basically like chickenpox. You're not going to get it again. This one, what you do is you'll develop antibodies, but they're not what's called neutralizing antibodies, which means you'll have antibodies against it, and you're more effective or efficient at fighting it the second time you get it. But the second time you get it, you're still going to get sick. You're just not going to get as sick. You become more efficient at fighting it. So it's almost like you learn about this. So it's a little bit of a far-fetched theory, but this thing could get watered down where everybody has seen it. Everybody has antibodies. We're going to be passing antibodies on to our kids. And 150 years from now, this is going to be another common cold, right? But today it's deadly. So because we will become so efficient at fighting it. Now, to get there, there's going to be a long road. So I don't think we're going to get to herd immunity. And I will be honest with you, because of that, because of the way that we don't develop these neutralizing antibodies, I don't think we're getting a vaccine anytime soon, because you're going to get a vaccine that produces antibodies, but the antibodies don't neutralize you against this disease. So I think if you're waiting for an antibody or a vaccine, you're going to be waiting an awful long time. We don't have a vaccine to the common cold. We don't have a vaccine to the HIV virus.
Right.
We're not going to get a vaccine, at least without significant side effects, because of the way they're hurrying this and rushing it through. We're not going to get a good vaccine for this. We'll get a vaccine that produces antibodies, but that doesn't mean you're immune to this. That just means you may be more efficient at fighting it, but along the way, you're going to compromise your immune system. There's a lot of vaccines that have come out that they had to take off the market because they were rushed to the market, and they actually, when you get infected with the bug, it kind of crosses with the one you got, and you have the super bug. So I don't think we're getting a vaccine anytime soon, or at least not a safe one. I don't think we're getting herd immunity anytime soon, but I do think this thing will mutate into a less serious strain. And as greater percent of the population gets it, they're going to develop these antibodies that make them more efficient at fighting it. So the third, fourth, fifth time you get it, you might sneeze or get a bad cold, and that's going to be about it.
Yeah, I've pretty much said the same thing all this time. I mean, if we do see a vaccine, on average, it takes about 4 years, from what I understand, for a vaccine to be created on average for a disease or for a virus. If we do see a vaccine, it's probably going to be something that's like the flu shot that you have to get, and you got to re-up on it like every year sort of thing, right?
Well, and the flu shot is a guess. So there's 160 strains of the flu, and they're guessing on what strain that is, and they haven't guessed right since they came up with the flu shot. But they have that same. They haven't. But
they're
they
going to
still
keep
have
trying.
that same. They're going to keep trying. And the argument for the flu shot is, well, we're going to give you some kind of antibody, which hopefully makes you more efficient at fighting the flu. I would tell you, it's the same thing I've said to Lark and his family: get healthy, stay healthy. Don't wait for the vaccine shot to come out. Get healthy, stay healthy, reduce your comorbidities. I don't think it's if we're waiting for the vaccine, I think they're going to rush it to market. It's going to come like the rotavirus did. It's going to cause massive side effects. They're going to wind up pulling it off the market. The fear mentality is going to drive everybody to get this without doing their due diligence, without worrying about it. It's a money grab because the first or second person that makes the vaccine is going to get a gajillion dollars. And it doesn't matter because they're not going to be held culpable for any of the side effects of the vaccine. And they're going to walk away with a pile of cash. Meanwhile, people aren't going to get healthier. So,
Chris, before I let you go, what are some of your, for anyone who's watching, what are some of your suggestions to help people be prepared if they do get it, or how to be one of the people that has, just loses their sense of taste or smell, and not, hacking up their lungs like Kenny was doing earlier for a seemingly healthy person. Kenny seemed to have had it pretty bad, for 40 and healthy-ish. But again, as he told us, he was in the hospital last night, but, he never felt like his life was in jeopardy. He just didn't feel good. He felt pretty awful. What's your advice for people to help build their, boost their immune system?
Yeah. So let me digress a little bit. It's great because he's a seemingly healthy person who had relatively mild effects. Now add 10 or 15 years to his life. And now if he does, even if it's not a fatality situation, if he's in the hospital for a week and a half and feels like crap, can't work for 3 weeks, that's what we want to avoid. So let's kind of extrapolate him and make him a little bit worse and a little bit older and a little bit less healthy. So it's interesting. Colleagues of mine wrote a paper to substantiate this. But if you do simple things like vitamin A, vitamin D, and something called NAC or glutathione support, they're super inexpensive supplements that have a massive effect on your immune system. Vitamin A, vitamin D, and something called NAC, which produces glutathione. The research is showing if your glutathione levels are healthy, you have very low comorbidity infections with this thing, and you have much better outcomes. That's one piece. A little bit of zinc goes a long way. A little tiny bit of zinc will go a very long way. So if you took zinc once a week or twice a week, you probably have enough zinc. A little bit of vitamin C. There's an herb out there called quercetin. Quercetin actually works a lot like the hydroxychloroquine, which allows the zinc to get into the cell. Super cheap. You don't need to get a prescription for it. You get quercetin, allows the zinc to get in the cell. When the zinc gets inside the cell, the virus cannot replicate. You neutered it. You neutered the virus when you get zinc inside the cell. So if you did a little bit of zinc, a little bit of C, a little bit of something called quercetin, vitamin A, vitamin D, NAC, and then reduce your inflammation. So when you get the virus, when you get sick with the virus, the first thing that happens is your immune system ramps up and you get inflammation. And that's what everybody's calling this cytokine storm, right? The cytokine storm is the immune response and how inflamed you are. So there's some natural things to reduce inflammation. And one of the best for your lungs is something called resveratrol, which is in the red wine, right? The grapeseed extract of red wine.
So he wasn't that far off when he said Scotch works wonders. He just
Scotch works wonders. Different, right? As long as it's in a wine barrel. So if you do the resveratrol, the A, the D, the NAC, a little bit of zinc, a little bit of C, and a little bit of quercetin. We had a patient, nameless, in Chambersburg, 84 years old, diabetic, with COPD, chronic obstructive pulmonary disease. All three of those are comorbidities that probably should have ended his life. He went in the hospital for 4 days, a little bit of oxygen just through a cannula through his nose, walked out fine. He was fine. This is all he did. So he had 3 major comorbidities, took a little bit of care of himself. At 84 years old, walked out of the hospital. Health of the host. It's got to go back to the health of the host.
Hey, Dr. Chris, thanks for joining us. Just a quick question. All those things you mentioned, we can get from like a local CVS, Walgreens.
Absolutely. They're not proprietary things. They're at every single, I would say, go to a health food store, a pharmacy, or place like that. I don't know that you could get them even at, you can get them at Walmart, for God's sakes. You could spend if you got all those and you got high quality stuff, and you got a 2-month supply, you're $60 max. And you're safe for 2 months, and you're going to do yourself a world of good. They're readily available. It's not like, oh, you got to get them at some special place behind, you can get them anywhere.
You said vitamin A, vitamin D, NAC, glutathione.
So I make it simple. NAC stands for N, the letter N, acetylcysteine. But if you walked into any health food store and said, I need NAC or NAC, they're going to know what it is. That's the cheap version that converts readily over to glutathione.
Okay.
So you don't have to, glutathione's real expensive. So I keep it cheap, keep it real. So NAC, vitamin D, vitamin A, you walk in, don't worry about the glutathione. And if you got zinc, if you got a bottle of zinc, it would last you a year because you only need to take 1 or 2 a week. You don't need to take it every day.
And what was that last one you had said? The one, it sounded like it began with a Q?
Quercetin, Quercetin, quercetin.
Okay, I'm going to go back to the recording to write that down because my dyslexia doesn't function well when it's time to write what other people
So quercetin, a lot of people take it for allergies. A lot of people take it for other stuff. But quercetin is actually the flavonoid that they made the drug Singulair. If you ever heard of Singulair and Malukas, the Singulair. So that's what that is, basically, from that. But you can get it over the counter. It works extremely well. It's extremely safe. All these things are extremely safe. You take them, a few things, any health food store, any CVS, any vitamin shop, any GNC, all of them have them. These are very, very, very common things.
Chris, thank you so much for jumping. I know I made you drive all the way back to the office to jump on this tonight as I was filling in for Kenny, kind of. So thank you for coming out and just speaking a little bit on trying to make people healthier and survive this and kind of deal with some of the rumors that are going on around it. And kind of, you know, if I give my opinion, I work in I'm a stand-up comic. It's my opinion on this doesn't really matter. Glenn, you know, you work in real estate. Yeah, it's people, when people hear you get their just another person's opinion. At least when you bring a doctor on that doesn't own political affiliations or heavy investments into big pharma, it helps a little bit. So thank you so much for hanging out. We appreciate it.
My pleasure. Thanks for having me, guys. Hope it was helpful.
Thanks, Dr. Chris.
Sure was.
My pleasure. All
right, boys. That's my big contribution. That's my big contribution into this is bringing Chris. Now, we've all seen what the coronavirus looks like the actual, what it looks like. I think the reason we all think it's a joke is because we all played with coronavirus as a child.
Yep.
I don't understand why. Why were we all taught to play with coronavirus as a kid? Like that's
we were all taught to play with a virus spore.
And it vibrated and it jumped around and we played with it.
Yeah.
Man, that is hilarious.
I don't understand why we were all playing with coronavirus like it was a toy when we were kids. Guys, thank you so much for letting me jump on. I'll start with my last words because I think we should all just take a couple minutes to do last words at the end of this, and then I'll go me, then Glenn, then Fred, just to keep it simple. And I'll just say this: we all saw in the beginning of this thing, one side of the political affiliation was overreacting clearly. Another side of the political affiliation was underreacting clearly. We have to remember that there is a reasonable amount of reaction that we need to have. And we need to not politicize a virus that's killing people. And we need to be serious about the virus. I am a person that wears a mask when I need to wear a mask. If I go into a restaurant, go into a grocery store, go in to pick up takeout, I'll wear the mask. I'm not a big fan of the mask. But at some point I have to look at it and go, I think this is more about public safety than it is about trying to take away my liberty. Now, if they're trying to keep me wearing a mask 5 years from now and this thing is mutated into the cold, maybe I'll have a different opinion. But I think there's the right reaction and the wrong reaction. There's the overreaction. There's also an underreaction. And I think as a society, we need to find that middle normal reaction. Thank you guys for letting me be a part of your show tonight. I'm what is it? Long-time listener, first-time caller. So thanks for letting me be a part of it. I'm going to pass it on over to Glenn.
Thank you very much, Lark. And just for those that don't know, Mark helps us out a lot with production and giving us tips and ways that we can make this show better for you guys. So again, we appreciate you being on with us, Mark, and taking the place of Kenny. Also, want to thank Kenny really quick for jumping on. I know he wasn't feeling too well. And guys, if you have any positive words for him, shoot him down in the comments, send him some well wishes. I'm sure he would love that and appreciate that. Again, just to piggyback off of what Lark was saying, there is a reasonable amount of reaction to this. At the end of the day, this is a virus. It's killing people. I know I kind of busted Kenny's balls a little bit and asked him if he was still on the side of Trump and thinking that this was a Democratic hoax. That's just the relationship that we have. He knew it was coming. But yeah, it just depends on the way that you look at it. But one thing I do want to make clear is it doesn't matter how healthy you are how unhealthy you are. I mean, for all intents and purposes, Kenny is a pretty healthy individual, and he still got it. So we do have to take this thing seriously. You know, when you go out in public, I'll be the first to tell you, I don't like to wear the mask. I have a beard. It's annoying. It's hot. And it just, I'm not a fan of the mask, but I do it. I don't do it for myself. I do it for others. I think of my wife and my kids. And so when I see other people with the mask on, I would like to think that they're doing it for, you know, my family, just as I'm doing it for their family. So we have to keep that in mind. It's not a civil liberty sort of thing or taking away a right or a freedom. You know, it really should just be to protect your fellow brother and sister. Right. So again, thank you all for being on. Thank you for listening. And with that, I'll go ahead and pass it off to Fred.
I appreciate it, Glenn. As we all stated earlier, thanks, Dr. Chris, for joining in. Awesome. We appreciate your time. I know it's not, you know, every night you can just join into a podcast, especially one just coming up, but we definitely appreciate it. Hopefully we can get you back on and give us some more insight onto whatever pops up next in our future. Lark, always a pleasure. It's always great to have you on. Definitely gives us all the advice we need. I mean, you can already tell he's professional. You can see his background in the mic and all the sound room and all that good stuff. So, and Kenny, God bless you. Way to come on strong, brother. I mean, I don't know how you do it, man. You sounded terrible, but we appreciate you showing up. Just keep getting better, and hopefully we'll get you back Wednesday. As for the virus, as my colleague said, man, it's tough, right? It's a very thin line. You can go one way or the other. It is a personal choice, but I think you need to be cautious of your surroundings and the people around you, right? So if you don't want to wear the mask, that's fine in your own environment, but do it for the other people. You don't know what those other people are going through, right? Sort of just like wearing your seatbelt. I think Dr. Chris said it earlier, wearing a seatbelt. You just do that out of precaution, right? So do this out of precaution. You know what I mean? It's a no-brainer. Just to be safe until we actually know what this virus is capable of. You know what I mean? Everybody's got to be safe. I hope you stay safe, America, and bring it back in, everybody. That's all I have. Good night. Stay safe. Wash your hands, and just love one another. All right. We'll see you again next time. I think Wednesday, episode 14. Good night, America. Love you.